Thank you very much. And it's okay if we all just stay seated here, comfy? Okay. Please be prepared to ask your questions. I was listening and thinking about rainbows and how the rainbow is a visual of an international symbol, in a sense, for the LGBT community. And that there are many who would think, we are in an era of rainbows in certainly the United States and in many countries around the globe. But there's storm clouds as well. That I guess it goes to the consistency, the constant need to change and address norms. And so I want us to think about that building rainbows, but the reality of storm clouds and how we can address those and look at those. I'm going to start by posing a question, and then I hope others will join me in connecting with the panel. So with the complexities of social norms in the last 2 days, and for me, the beauty of cultural diversity and the many ways in which we in this room identify and go through life, how do we help our colleagues, our neighbors, and policymakers kind of get that, connect with that working for lesbian, gay, bisexual, transgender, intersex, two-spirited rights, equity, is working to end violence. We only have a certain amount of time, but if you have the answer for that. So.
I guess brief answer, I think for me it's twofold. I think one lesson learned for us from the conversion therapy work is really that so much distress and so many issues later in life can be mitigated by working and thinking about family units or community units rather than individual experiences. So normalizing LGBT identities is a lot more about helping other people understand them as opposed to helping individuals change their own circumstances, if that makes sense. And I guess the second part of it is everyone can relate to the experience of being othered, and everyone can understand. So we were talking earlier about collective trauma and scapegoating, and I think situating LGBT equity within a narrative that explains sort of the cumulative effects of repeatedly being othered might help it be more relatable.
Yesterday's research, which was really quite clear to me, is, we know from our monitoring and evaluation that dialogues on a whole series of topics and bringing people into a table where they are able to express and learn yields results. I don't think anyone is naturally born homophobe or naturally born in these kinds of ways. They learn this behavior, and as I heard yesterday, it took many years to learn this behavior, and it takes some time to unlearn and to try new behaviors. So I think that we need to see in communities more dialogue on these issues. We need to see, we need to accept that people can learn. We need to look at people not as the enemy, but as ways we need to bring them on because they're not yet there. And some people will never get there. But for those that are able to, because we are transforming, America was not where it is today, where they have an ambassador on LGBT. It took many years to get here. It took President Obama, his own personal evolution. And no matter how old you are, people are evolving. Some may not want to, some may be held behind. That's unfortunate. But for those that are able to move on, we need to support them. We need to celebrate them. We need to use them as heroes. And we need to be able to, highlight their work and their recipes for combating violence and discrimination in their communities and in their homes. I wish there was some really easy way to do it, but it's more of what we're doing and accelerate it and maybe scale up from demonstrations around dialogues to actually having more of it. I've heard new sexual education curricula in schools. It's amazing that still in America, in many American states, they use socks on hands to demonstrate how to put a condom on. This has got to stop. People have got to become realistic about what it is to navigate the dangers of the 21st century, of young people having access to the internet, being able to see things that they never would have seen except go through life's experiences. They're seeing things at 13, 12, 13, 14 years old that we never saw before. So access to information is out there. We need to arm them better, and people have to be realistic and really push back against those who feel that this is someone else's job or their job. They're doing a lousy job of it. And we've got to be able to really look at it town by town. We can look at it as cities approach. We don't always have to try everything nationally. We can try things in urban centers. We can try things in certain communities. We now have mapping that tells us here is where a problem is, here's the group, here's the place they live. We now know things that we didn't know because we have new data. And we've got to use that new data to perhaps articulate, allocate our resources differently, and allocate who we want to reach differently in these places.
Thank you. Richard, you mentioned criminalization. And in March of this year, a report came out of the University of Southern California on discrimination, harassment by the police and first responders. And that was cited as a major crisis in moving forward. And you mentioned Equal Eyes as citing demonstration projects, programs that are working. Have either of you seen any effective change in the role of first responders, and particularly the police?
Thank you. We're going to take a couple questions so we can hear them. So, Michelle.
Thank you very much. I really appreciate it. And I would have to say I'm really proud that Together for Girls and UNAIDS is a key partner for our partnership. I guess I want to push you both a little bit. This is not necessarily an advocacy meeting, and we all, I think, understand the vulnerability of these populations and some of the experiences they have. But what we're trying to do is identify evidence-based best practices for prevention of violence in these difficult and marginalized communities. And I understand that this science is very, very new. And that it's not, we're not, you know, you have to start with identifying the problem before you can actually get on to like implementing the solutions. And we've heard some good thoughts about solutions. Is conversion therapy a form of violence? Probably. You know, what's happening, we know globally, is very serious. So my question to you is based on the need to really deal with the violence piece of this issue. What do you think the opportunities are to inject much better measurements into the various tools, surveys, and work that you are both doing through your various organizations that actually will look at violence incidents and then be able to help us show what interventions really are delivering results in terms of reduction of violence? Thanks.
Let me start with at least some evidence around the police and how that's worked. And we've seen projects in India, projects in lots of different places dealing with sex workers, drug users, marginalized people who have been, you know, on the front lines dealing with the police, being arrested, being harassed, being what do they call it, shaken down, has to pay bribes and so on and so forth. What we know and what evidence demonstrates is dialogues with the police, engaging frontline responders and having a conversation with them, demonstrating the impact of a different approach, that their approach is not leading to the results they're seeking, but in fact there are other approaches. There is evidence from different parts of the world to demonstrate that engaging with police forces, engaging with, in dialogues with localized police, talking about the issues, introducing them to community members, having those community members speak openly about how policing is impacting them around clients, around safer sex, around lots of different things, and how, you know, we see that their work, you know, as the first respondent is important. They sometimes are the perpetrators of violence. They are the rapists of many young men are raped by police when they're arrested. We've seen this over and over. The evidence is now in, and I'm not going to cite them all, but that evidence is here, is engaging them right up front, making them part of the solution is really what works. And it has worked in different cultures across the world. It's just not, the problem with these demonstrations are we've seen enough demonstration projects. The question is, how do you take a demonstration into scale up? So we've all seen across the world these things work, these dialogues work, these incentives work. The question is, how do you take small things and make them broad and big? And that's when we start to have the problem of political will. And that's when, no matter what evidence you put on the table, you have another layer to go through, which isn't always about evidence. It's about something different. So I'm not sure I'm answering that one completely. And maybe, what are all the strategies and where's all the evidence of projects that reduce violence? I heard about 14 of them yesterday being mentioned by almost everyone sitting around a panel. The problem continues to be from small village to large town. How do you maintain this over a period of time? And how do you go to the youth group, to the youth population, so that they actually don't become adults when then you have to reprogram both their behavior or other patterns that might not be easily changed when they're in another thing, such as gangs or other things, which is more difficult to escape. How do you reach them before you get there? And what programs are in place to, head start young kids to take a completely different view? Because they really are the future. Their attitudes are very different toward these topics. But something happens, peer pressure and others, that lead them to become less tolerant and perhaps also instigators of violence. Or, as we know, often perpetrators of violence are themselves, as we know, abusers, gay themselves, and they have to demonstrate that they are less gay by beating up LGBT people.
I'm actually just going to start here because I have two short answers. The Community Relations Service of the Department of Justice actually worked with law enforcement, transgender law enforcement, and the transgender community to develop training for law enforcement specifically on ameliorating relationships between the trans community and law enforcement, which is a long and storied past. So that's one example that I could give of sort of interventions that are being created to specifically address that problem. I will just say that in addition to sort of issues with law enforcement, we also see really disturbing amounts of violence within the criminal justice system. For example, in California, one study reported that 59% of transgender women who were being housed in male prisons had been sexually assaulted. So certainly much more work to do on that front as well. To your question, I really appreciate the question. I think it's a complicated and challenging issue. So one evidence-based practice I will go back to is the Family Acceptance Project, which I think is the best research that we currently have about outcomes for LGBTQ youth who experience family rejection and interventions that specifically address those outcomes. But I do just also want to say, we have so much evidence about, if we're talking about sort of social norms and cultural acceptance of violence, we have so much evidence about the negative experiences across such a range of, and I also would encourage us to think about suicide as a form of violence that we should be addressing, as it's like the second leading cause of death for youth and, like ages 12 to 24, and LGBT youth are at much higher risk of suicide. So I think there is some evidence in the States that looks at policy changes and how social norms have changed, and I would be happy to sort of follow up and provide some of that if that's useful.
Just as a quick follow-up, I really appreciate this, but I think the other part of my question has to do with our ability to inject measures of violence into everybody's work. So I'll give you an example outside of your context, but very much in the HIV context. So we have, for example, through UNAIDS and the Global Fund and many other mechanisms, multiple programs that are, for example, are looking at, let's say, the effect of cash transfers on the reduction of HIV, and a lot of discussion on the relationship between HIV and violence. And we know that being HIV positive, definitely exposes you to great higher levels of violence, but we also have pretty good evidence that suggests that exposure to violence, increases your rates of HIV. But we don't consistently inject into various pieces of research, very specific questions on violence. So we can't really, we don't have we don't have the measures. And I guess what my plea is that for both of you in your spheres of influence to make sure that when you see study designs on, well, how well is this working, that one of the questions be around violence so that we can actually start to increase our knowledge about it. So thank you. I really appreciate letting me go.
That's fine. Did you want to answer?
Yeah, I mean, I would say I completely agree, and I would say the corollary to that is when you're doing studies about violence, if we can interject questions about LGBT demographics, we will have a better and more robust evidence base.
So we've identified a gap, which I think is a really critical part of presentation and context. I want to go to Arturo and Patrick, and we'll take both questions, and hopefully we'll have time. And Pauline.
Thank you very much for your presentations. I was putting together the first panel with this one, and as Michelle says, how could we better work together and identify best practices in prevention? And we've all been discussing very complex phenomena with many different types of sub-classifications and multiple factors that affect it. But given this reality that Tani was explaining earlier on, in which many people live in environments of chronic violence and chronic human rights violations, I would ask you to, if you think we are, by fragmenting the different types of violence and the different types of populations and not focusing on this human development as a goal, adequate human development, wellness, this life course approach to human development that Tani was also putting on the agenda, it seems to me that there's an opportunity to discuss if it's not better to look at these issues from the wellness and the salutogenesis perspective, which would allow us to take in all of these different types of systemic violence that is affecting through the life course, and actually build those spaces that Tani was referring to and allocate resources for the discussion and practice together with the groups that are currently around the subject, the SDG, Agenda 2030, and the SDGs that were put there by the Violence Prevention Alliance, the work of this group, the work of USAID, World Bank, and many public health and funding institutions. Is it a ripe time for coalescing around major goals? Would that not be a better idea than to try to fragment and specify different subgroups?
Thank you. Richard, thank you very much for the shout out about the report we facilitated by the Academy of Science of South Africa. You know, this issue can be addressed at different levels, the community level. Here at the National Academies, I don't work very much at the community level. I'm more at the national level and higher. And what really galled me about the situation in Uganda was this was being played out at the parliamentary level and at the level of the presidents. And I'm wondering what does, you know, you're at UNAIDS, so you're actually at an intergovernmental type of organization. What does UNAIDS do, or what would it want to do to facilitate eliminating the misinformation that turns these political leaders into effectively, I think, endorsers of violence? So much of the Ugandan justification was based on gross misinformation. I'm wondering what we should be doing to help help inform the leaders of these countries, the people who are opinion shapers, about beliefs that they have that are completely groundless.
Thank you. Pauline? And then Damien, we'll take your question, and then I want to get them on the record, and we'll see how many we can get through.
Thank you very much for very powerful presentations. So my question is on the issue of intervention. When you think that an intervention, especially an outside intervention, is going to make a difference, but what it ends up doing is to isolate the LGBT community further and even stigmatize them further. And actually make the valiant, or rather the people who are making these policies, become heroes in some regions. In the case of Museveni, when the US government pulled funding, and funding from faith community, funding from some groups that were actually helping, in my opinion, they may have stopped the law from being passed, but what happened was a backlash, you know, and Museveni became a hero of African values because the US government was seen as imposing their values on Africans. So I think that's one thing. And then on the issue of working together, I think, you know, we are not going to win if we work in isolation, but we all have to examine ourselves. You know, does a gay man stand up and say rape against women is wrong? Does a woman who advocates for women and women's rights stand up and say violence against a gay man is wrong? Because the war against racism has not been won yet, but people of different races who are not victims had to stand up. So people who don't belong to the group that is being persecuted will need to stand up. But there has to be examples from both sides, not one side. Thank you.
Damien, and I'm going to ask you to talk really quickly so we can get to some answers. Thank
Okay.
you.
Just real quick, you mentioned Kingston in the slides. My organization is actually working with 60 of those homeless youths who you mentioned were in the sewers there. And the reason why we are working with them is that they have been highlighted as a high-risk group, one of the most high-risk groups within Kingston, committing violence within their own population. And that is something that we're struggling with, and something that has to be looked at, because the Buggery law in Kingston, in Jamaica, is not going to be repealed anytime soon. It's any political party that does that will commit political suicide, and the churches will ensure that they lose whichever the next election that follows. So in the meantime, we have to deal with this group, this homeless group, that has created its own subculture, and germane to that subculture is violence amongst themselves, between themselves, extreme violence, and they have now and they're not victims. We've done case studies with all of them, all 60. And most of them have good relationships with either their mother or their father or both. But they have chosen to be on the road because they can't be free in their community. So it's not their immediate families where they have the challenge. It's being free to be themselves in their communities. So they have chosen this for themselves. The issue is, now that they have chosen this, they have built up their own way of life and customs that produce a lot of ills that need to be treated with. So just adding that to the conversation.
Thank you. I have received a 1-minute warning when I thought we had 5 minutes, so I apologize to those who have questions and an opportunity for dialogue. But I heard clearly some examples of how the complexities that when we can't compartmentalize LGBT youth, violence issues, homelessness, an example, and Pauline's example and the idea of really building collective response. I would love to hear thoughts about fragmentation and coalition and how we might facilitate address misinformation and interventions that can create interventions. I think the challenge is going to be is to ask you both to make a fantastic summary statement so we could move forward. And you may not have the opportunity to address those questions, but you saw who asked them and you could connect with them. So please, your thoughts to the community in front of you and those on the webcast.
I mean, I guess I do want to address Arturo's question slightly and just say that I think the solution is not fragmentation, but it has never been the case that not fragmenting a community meant that its unique needs weren't still present. And so any kind of coalition building, any kind of effort that we have moving forward to combat violence takes into account the needs of women, or should. Similarly, the needs of people with disabilities or people living with HIV/AIDS, and LGBT people also. So I think if we're talking about data collection, if we're talking about research, if we're talking about any kind of intervention, I think we should all be working in coalition idea resonates and also needs to be culturally competent and also should include the needs of LGBT people.
I think trying to see the forest through the trees is really a complex issue, and it comes with maturity, it comes with timing, it comes with opportunity, it comes with all sorts of things that are sometimes beyond our little control. It's the right leadership, the right intersection of all these elements, that sometimes we have them, and sometimes we don't, and sometimes it takes us a long time to get there. It should be of no surprise that the United Nations, this huge institution with a lot of experience, can't stop a battle between leaders, which then pulls their whole country together. So you ask yourself, well, what does us community sector, how do we actually make some things happen? Well, sometimes we just got to make them small. And maybe that's what we can do, and hopefully they can be duplicated. Sometimes you have to dream and have a vision of how you want to do that. The academies work to go and say, we're going to work with other science academies to have locally generated information taken by their own scientists, had a huge impact. We need to see more of that. Take away the argument of it's from the North. It's from you. I mean, there's neo-colonialists from religion, as was mentioned yesterday, from development institutions, all sorts of people. What the beauty of that report was, it really was generated by African scientists, then endorsed by the Ugandan scientists, and suddenly that argument from two countries was taken away, and it's really a good report. The other issue that UNA is, what do? We facilitate and we can convene, and we have a certain authority over that. We've tried to bring parliaments together that were considering laws. Prevention. We know these laws are going to lead somewhere. How can you actually see, not wait for the impact of a law or wait for a law to be passed? How do you stop things from happening? How do you do the prevention? And we realize, number one, you have to have your ear to the ground. You cannot be divorced from trying things and taking risks. Some of them will not work. We brought together parliamentarians from Kyrgyzstan as they were considering a law which was so draconian, and sitting with them and showing them other ways of doing it. What are those best practices when you're facing these kinds of situations? It's really a one-on-one and changing one person at a time, including parliamentarians who themselves are going to be using popular opinion, or even having their own personal homophobic or non-progressive approaches, decide how they want to vote and how they want to bring in new bills, often backed with money. We know that PEPFAR for years, and the research is demonstrating, the early years of PEPFAR, when they funded many organizations to go in country and actually try to preach things like abstinence and so on, that didn't work. It took many years. But the damage was done of having a lot of groups who believe this is the way we can solve a problem. And in fact, we learn now that's not it is. So, I'm not sure I know the answer. Well, I don't know the answer to all of this, but I know we can learn. And I know that, gay men who have at least a lot of media in this country and many parts of the world have not done a good job of joining forces with the women's movement, because we can stop violence. It's perpetrated by men on a lot of different people, including, how we can work with this issue. And I think we really have to rethink what it is that these movements have to be.
Richard, thank you. I have gotten the official stop sign delivered by Shelley. Thank you. I just want to thank you all. We've addressed social norms from the individual, community, provider, policy levels, a lot of food for thought. Join us, please, if you can go outside and quickly grab your lunch, and we're going to come back and have a lunch conversation. And whoever comes after me will help us get back on track with time and clarify what our next steps are. Thank you.